Hi, this is Dr. Virginia von Schaefer, and I wanted to talk to you today about the importance of having a healthy immune system and how this can be achieved and what it can do for you. Of course, we're all very much aware of immune system issues today with the outbreak and spread of COVID-19 virus. And although that's a special situation and certain people are more susceptible to it than others, it should bring our awareness to focus on the immune system and how we can strengthen our immune system, prevent illness, prevent getting COVID, other than the typical measures of isolation and protection, but to strengthen yourself from the inside out. And interestingly, these measures are something that have great benefit because it's the core of anti-aging. Inflammation is the problem in our bodies, and people can have chronic inflammation either from chronic disorders, autoimmune disorders, whatever, or we can just have inflammation from undiagnosed surreptitious infections like parasites, bacteria, fungus, candida, and other viruses. So the key to having a healthy immune system is not only taking a bunch of supplements that are going to help you, but it's really focusing on finding out how you can help your immune system and optimize its function. And that means find out what your immune system is dealing with in your own body. Some people will have symptoms of immune system dysfunction, and other people are asymptomatic. However, it's always a good idea to go through some simple screening to understand what's happening in your body and then figure out if there is something, what can we do about it? Create a treatment plan. The immune system is your number one defense against outside invaders or unwanted entities, the virus, the bacteria, the fungus, the parasites. And if there are too many assaults on the immune system at any one time, that can deplete your immune system resources and make it impossible for you to defend yourself in a situation of even greater importance, such as cancer. So decreasing inflammation in the body is our goal. And we like to do this by, number one, assessing what you have. And obviously, we have many tests that can tell us if there is inflammation in the body, blood tests. There's a special prime spot test that can tell us if you have viruses of a significant amount in your body, either intracellular or extracellular. We also have other blood tests for entities such as Lyme and even chronic infections in the bowel. So the basic way to your health is to decrease the inflammation. Now, there are many ways to do that. We have some simple ones that we like to use, and they're called peptides. So, what is a peptide treatment? The peptide treatment that everybody knows about is insulin. So basically, a portion of the DNA that codes for bringing the glucose out of the cell and into the cell was sequenced and synthesized and put it in a bottle, and people take it as extra when their insulin in their own bodies isn't working or they're not making enough. So the same thing is true for peptides. And there's an organ in our bodies that we have when we're younger. It's called the thymus gland. And it helps direct development and production of immune system defense all over in your body. The thymus gland rests right around here, and it's kind of good size when you're born, but as we age, up until about the age of 18, it kind of involutes and shrinks and turns into kind of like a pea-sized thing, unless you have a tumor of it of some sort. So as adults, we have immune system defense areas in our spleen, in our bone marrow, in our bowel, places all over in the body. But the thymus gland is not actually producing for us as adults. So one of the ways we can supplement our immune system function is to add that active portion of the thymus peptide that can help stimulate the immune system function. And this is what we commonly do. And it's a product, it's called thymosin alpha-1. You can get it in an IV, which I recommend to people who have been exposed to COVID or they're recovering and they want to boost their immune system. I have give it to cancer patients when they're receiving chemotherapy. It keeps their white count up and their platelets normal. It's excellent. Even if you had a cold and you took an injection, it would help you get better really, really quickly. But many patients choose to take it, a little subcutaneous injection of it once a day for a few weeks at a time, maybe take a couple weeks off, then go back on. It's a very good treatment. It's simple. It's something you can maybe start in the clinic, but you can continue doing at home on your own. And it gives marvelous results. I've had patients take thymus extract and tablets and pills and other things, and frankly, the peptide is the most efficient, the most effective, and once you get your immune system boosted, you can kind of back off on using the treatment. So I like it very much, and it's very effective. The other thing that people don't think of too often, but I've found is very, very useful, is mistletoe. Now, mistletoe, that's that berry that people kiss under at Christmas time. And it's an interesting plant. It doesn't have its own roots, and so it lives as a parasite, or what they call a saprophytic plant, on other trees. And it's a very ancient art of cultivating it, harvesting it at a certain phase of the moon, taking those berries that have extracted and concentrated polysaccharides and plant lectins inside the berry, then picking it and distilling it, extracting it, and using it for medicinal purposes. And it's well known in cultures since ancient times to be highly effective for boosting the immune system and also for treating cancer, which involves boosting the immune system. So when I've used it to treat cancer patients in high doses, up to 1,400 milligrams a day and by IV, you can use it IV or subcutaneously, but we all noticed that it was profoundly anti-aging as well. So it's a kind of interesting crossover because boosting your immune system, decreasing inflammation, helps you achieve longevity as well. So the specific thing it does is it increases all of your immune system cells, the T cells, the B cells, the helper cells, and your natural killer cells that are involved in, obviously, defense against unwanted entities. However, the thing that people forget to notice is that it's DNA protective to normal cells in the presence of sick cells or cancer cells. And so this is a very good defense for your body on many levels, regardless of what your situation is. So often I will give patients a short course of the intravenous mistletoe, and people notice they look better, they feel better, their skin is much, much better, and lots of people look a lot younger too. So it's a nice treatment to boost your immune system and also help with other things that we all like to have in terms of looking and feeling good. But the end message is that your immune system is your primary defense, and if your immune system is taxed, you'll have chronic inflammation, and this will lead to you being susceptible to other problems. And of course, as I said, aging is one of them, because when you have inflammation, proteins don't fold properly, and this kind of protein crinkling that occurs with aging, and you see it in your skin when you don't like what you look at. This is what's occurring even on a cellular level in other areas besides your skin and subcutaneous tissue. So the most important thing is respect your immune system and treat it and take care of it.